A very good morning, everybody. As a part of embryology concerned with the thoracic cavity, today we will discuss about the development of the respiratory system. At the end of the session, people should know the various components of respiratory tract. Okay. Anatomically, the respiratory tract is divided into two parts. Number one is the upper respiratory tract. Number two is the lower respiratory tract. The upper respiratory tract consists of nose, pharynx, that means the nasopharynx, oropharynx, and the paranasal air sinuses. Whereas the lower respiratory tract consists of larynx, trachea, principal bronchi, intrapulmonary bronchi, and lungs. And functionally speaking, the respiratory system is divided into two parts. One is the conducting part, number two is the respiratory part. And here the conducting part includes entire upper respiratory tract, where I have mentioned is a URT. And not only the entire upper respiratory tract, it also contains lower respiratory tract up to terminal bronchioles, and it is concerned with the cleaning, warming, and moistening the air. Whereas the respiratory part includes the respiratory bronchioles, alveolar sacs, and it is more concerned with the exchange of gases. This is an overview of the respiratory system. Now let's move to the development of the respiratory system. To strictly speaking about the development of respiratory system, now we will discuss in few steps. So we have few steps. So accordingly to the steps, we move in detail about the development. Now here we will dealt the development of respiratory system in following steps. Number one is the developmental primordial of respiratory system. Number two is the development of respiratory or laryngotracheal diverticulum. Number three is derivatives of respiratory diverticulum. Number four is separation of laryngotracheal tube from foregut. Invagination of lung bud into pleural cavity. So I want to make it very clear and very easy to understand the development of respiratory system in the following headings. So first we talk about the development of the primordial of respiratory system. So under this, one should know that the respiratory system is endodermal in origin, and it develops from the median endodermal diverticulum of the foregut. So here if you see in this section, in this diagrammatic presentation, now here this is the diagrammatic presentation which is making you to clearly understand the site of respiratory diverticulum. Now this is the site of respiratory diverticulum. This is the site of the respiratory diverticulum. Now this is an embryo of 25 days old embryo, and here this is the sagittal section, and here this is the site of the respiratory diverticulum. I will make it zoom so that you can see very clearly. Yeah. So this is the site of the respiratory diverticulum. So this respiratory system, it is taking origin in endodermal. It develops from the median endodermal diverticulum of the foregut. So this entire thing is the foregut, and from the foregut you are seeing and median endodermal diverticulum of the foregut, and this is called as the respiratory diverticulum, and this appears when the embryo is about 4 weeks old. And not only this, the respiratory system will also develop from the adjacent splantano-pleuric intraembryonic mesoderm. So two things. So respiratory system is developing from two things. One is it is developed from the median endodermal diverticulum of the foregut, which is called as the respiratory diverticulum. Not only that, the adjacent splantano-pleuric intraembryonic mesoderm is also taking part in the formation of the respiratory system. Now, therefore, here The lining epithelium of the larynx, trachea, bronchi and lungs are derived from the endoderm, whereas the connective tissue, cartilages, muscles and other the tissues related to the respiratory system develops from the splanchnic mesoderm. So I think it is very clear for you people. The epithelium, the lining epithelium of the larynx, the lining epithelium of the trachea, the bronchi and the lining epithelium of lungs, all these things are derived from the endoderm, whereas the connective tissue, cartilages, muscles and the other factors related to the respiratory system, they develop from the splanchnic mesoderm, which is surrounding the foregut. Is it clear? Yes. Like for example, if you take the larynx, if you see, the larynx has got epithelium, it has got cartilages, muscles and it is also supplied with a nerve. So the epithelium of the larynx will be developed from the endoderm, whereas the cartilages and muscles will be developed from the splanchnic mesoderm. Likewise, for example, if you see the cartilages like thyroid, epiglottis and cuneiform, they develop from the fourth arch, whereas the cartilages like cricoid, arytenoid, corniculate, they develop from the sixth pharyngeal arches. And the nerve which is supplying to the larynx is by the vagus nerve and by its branches. Likewise, trachea also will have the epithelium which is derived from the endoderm, whereas the muscles and cartilages and fibroareolar tissue which is surrounding the trachea, they develop from the splanchnic mesoderm. So this is all about the development of the primordial respiratory system. Yeah. Is it clear, everybody? I hope you are following. Now next thing is the development of respiratory diverticulum or laryngotracheal, both are similar. Development of respiratory or laryngotracheal diverticulum, both are same. So we will talk about this. So here the development of the respiratory system is first seen as a midline invagination outgrowth from the ventral aspect of the cranial part of the foregut. So again he says that the development of the respiratory system, this is first seen in the midline invagination. So in the midline there is an invagination, or you can say that an outgrowth or outpouching from the ventral aspect of the foregut. So it's in the midline from the ventral aspect of the foregut, you can see an outpouching or outgrowth or invagination of a diverticulum, and which is called as respiratory diverticulum, or this respiratory diverticulum is also called as the laryngotracheal diverticulum. Next thing, the respiratory diverticulum or the laryngotracheal diverticulum is just caudal to the hypobronchial eminence. Now the next paper, yeah. Now this is, I think, hope you all know this picture. This is the pharyngeal arches, you can see over here, and these things we have discussed very clearly when I was talking about the development of the tongue also. Now here in the pharyngeal arches, what is saying, this laryngotracheal diverticulum or the respiratory diverticulum, it is present it is present just caudal to the hypobronchial eminence. So this is the hypobronchial eminence, and this is the epiglottic swelling. This yellow color structure is epiglottic swelling, and this hypobronchial eminence. So just caudal to this hypobronchial eminence and the epiglottic swelling, you can see there is a diverticulum which is called as a respiratory diverticulum or laryngotracheal diverticulum. So what the point is, like, this respiratory diverticulum or the laryngotracheal diverticulum, it is just caudal to the hypobronchial eminence in the floor of the pharynx. Yeah. So next, the extension of this laryngotracheal diverticulum, it extends caudal direction and it is elongated. Its growth will be caudal and it is elongated. So extension is in caudal direction and it elongates. So this is about the second stage or second. Yeah. Next, coming to the third one, the derivatives of the respiratory diverticulum. Now first we have discussed about the primordial respiratory system. In that we discussed that the respiratory system develops from the mesoderm and also from the adjoining splantinopleural intraembryonic coelom. In the next, the development of respiratory diverticulum or laryngotracheal diverticulum, in that we have discussed like this is developed in the midline invagination from the foregut, from the ventral aspect like outgrowth. Yes, yeah. Then coming to the third stage, the third phase, the derivatives of respiratory diverticulum. Now here, the free caudal end of the respiratory diverticulum grows downwards to enter the thorax, where it becomes bifid to form the right and left bronchial buds. Now here, yeah. Now I think hopefully you're following my class. Now in this, now this is the foregut and this is the respiratory diverticulum. From the ventral aspect of the foregut, you can see an outpouching which is called as the respiratory diverticulum. Now this respiratory diverticulum, what happens? Now what are the derivatives of this respiratory diverticulum? So this respiratory diverticulum is giving off some structures. So this respiratory diverticulum gives off what? It gives the derivatives like larynx, trachea, the bronchi, the lung parenchyma. All these things will be derived from this respiratory diverticulum. So first, initially the diverticulum, the free end, the free caudal end, this is the free caudal end. The free caudal end of the respiratory diverticulum grows downwards, enters into the thorax, where it becomes bifid. See here, it is becoming bifid. It is getting bifurcated. It becomes bifid to form right and left bronchial buds or lung buds. So these are called as what? These are the bronchial or lung buds. Bronchial or lung buds. So they enter into the thorax, where they become bifid to form right and left bronchial lung buds. Next, the part of the diverticulum cranial. The part of the diverticulum, this is the cranial part, this is the caudal part. So caudal part is bifid, it is becoming bifid to form the lung buds, whereas the cranial part, the part of the diverticulum cranial to the bifurcation, follow, cranial to the bifurcation is laryngotracheal tube. Now this is laryngotracheal tube. Now in this slide you can see very clearly. Now this is the caudal part of the respiratory diverticulum, which is the caudal end is becoming bifid, which again in turn it forms the lung buds. But the part of the respiratory diverticulum which is cranial to this caudal end, which is cranial to the bifurcation, now this part is called as laryngotracheal tube. It is called as laryngotracheal tube, and it forms larynx and trachea. Now this part, the cranial part of the respiratory diverticulum is called as laryngotracheal tube, and this part of the laryngotracheal tube will give rise to the larynx and the trachea, where the lung buds from the bronchi, means the lung buds from the bronchi and the lung parenchyma. Is it clear, everybody? So the caudal part will form the lung bud, and they form the lung parenchyma and the bronchi, whereas the cranial part will form the trachea, larynx and the trachea. So this is about the third thing. And next we have the fourth, which is the separation of laryngotracheal tube from the foregut. The separation of laryngotracheal tube from the foregut. In the third point, we have discussed derivatives of respiratory diverticulum. So in the respiratory diverticulum, you know that the caudal part is getting bifid, entering the thoracic cavity, getting bifid and forming the lung bud or bronchial bud, whereas the cranial part will be forming the larynx and the trachea. The caudal part forms the lung bud, whereas the cranial part forms the larynx and the trachea. Now next thing, the part which is above the lung bud, which we call it as the laryngotracheal tube. Now The next point is the separation of the laryngotracheal tube. The separation of the laryngotracheal tube from the foregut. Now what's next? So this laryngotracheal tube has to be separated from the foregut. So this is esophagus. So esophagus and this laryngotracheal tube, they have to separate it. But how? You see, initially they have the communication. The next stage also they have some communication established between the foregut, which is esophagus, the pharynx, and this laryngotracheal tube. And how do these two get separated? So the separation of the laryngotracheal tube from the foregut. Now here the groove separating the ventral pharyngeal wall of respiratory diverticulum is laryngotracheal groove. Laryngotracheal groove. So there will be a groove which separates the ventral pharyngeal wall of respiratory diverticulum. Ventral pharyngeal wall from the respiratory diverticulum. Now here you can see this is the foregut and this is the respiratory diverticulum. So there is a, there is a separation. There is a groove. So this groove is called as the laryngotracheal groove. Laryngotracheal groove. So the groove separating the ventral pharyngeal wall and the respiratory diverticulum is laryngotracheal groove, and this groove appears in the 4th week of intrauterine life. In the 4th week of intrauterine life. In the 4th week of intrauterine life. Next, the next point is here, as the laryngotracheal groove, as this laryngotracheal groove deeps, it becomes deepen to form a longitudinal diverticulum, which is called as respiratory diverticulum. As this laryngotracheal groove, which becomes more deep, and that forms a longitudinal diverticulum, which is called as respiratory diverticulum, or it is also called as the laryngotracheal diverticulum. Next, at the caudal part of the respiratory diverticulum, the two lateral folds. At the caudal part of here, if you see here, there is a compression. The two lateral folds known as tracheoesophageal folds. This is the trachea, this is the esophagus. So between these two tubes, laterally there is a fold which is called as the tracheoesophageal folds, which grows medially, and this medially and fuse, and they become fused to form a septum, which is called as tracheoesophageal septum. So what is happening between the foregut and the trachea? The lateral folds are formed, and these lateral folds are called as tracheoesophageal folds, and these folds grow medially and fuse with each other. So this is one lateral fold, this is one lateral fold. These two lateral folds will move medially, and ultimately they both get fused with each other, forming a septum, which is called as tracheoesophageal septum. Is it fine? This is a transverse section you are seeing here. Okay. Next, the tracheoesophageal septum. Now in this section you can see very clearly there is a clear demarcation between the esophagus and this trachea. Clear? So between the esophagus and trachea you can see a clear demarcation. So and this line, this black color line, which is called as the tracheoesophageal septum. How the septum is formed? The septum is formed by the lateral folds. By the lateral folds, which are known as tracheoesophageal folds. Tracheoesophageal folds. These folds move laterally, these folds move medially and fuse with each other to form the septum. So this tracheoesophageal septum extends caudocranially. They extend from downward, they extend up caudocranially, and continues to communicate with the pharynx. So where you see, if you see the cranial part of this tracheoesophageal septum, if you see the cranial part of the tracheoesophageal septum, it communicates with the pharynx. The communication with the pharynx forms inlet of larynx. So inlet of larynx is formed with the communication of the larynx with the pharynx. So the communication with the pharynx forms the inlet of larynx, which is also called as the furcula of his, through which the laryngotracheal tube communicates with the pharynx. So there is a communication between the the pharynx and the larynx. Yes, laryngopharynx, right? So through this laryngeal inlet, the communication will be with the pharynx. Clear? This is all about the separation. This is all the separation of the larynx. Next we see this, the last, which is called as the invagination of the lung bud into the pleural cavity. So first is development of the primordia of the respiratory system, you know it. Development of respiratory system also, you know it. That means the laryngeal diverticulum, how it is developed, from where it is developed. Then derivatives of respiratory diverticulum also, you know, like how it enters thoracic cavity, how it get bifid. Yes, the upper part, cranial part, forms the larynx and the trachea, whereas the lower part, the bifid part, will form the lung and the bronchi. The separation, how this laryngotracheal tube is separated from the foregut by the septum. Yes, by the tracheoesophageal septum. You know how the tracheoesophageal septum is formed by the lateral folds moving medially. Yes, they get fused with each other. And cranially, there is a communication is established between the tracheoesophageal, the laryngotracheal tube and the pharynx, where it is forming an laryngeal inlet, and that part is called as laryngeal inlet, and through which the laryngotracheal tube communicates with the pharynx. Now coming to the last point, which is invagination of the lung bud into the pleural cavity. Now you know that this the caudal part of the laryngotracheal diverticulum, it enters in thoracic cavity, and there it get bifurcated. There you get bifid, and that bifurcation, or the bifid part of the caudal part of the the laryngotracheal diverticulum is called as a lung bud. Now each lung bud invaginates into pericardio-peritoneal canal. So these lung buds, as soon as they enter into the thoracic cavity, they invaginates into the pericardio-peritoneal canal. The right and left pericardio-peritoneal canals form right and left pleural cavities. So they invaginate into right and left pericardio-peritoneal canals, form right and left pleural cavities. This is all about the developmental stages of the respiratory system. Now here you can see this one. This is the diverticulum, and this is the laryngotracheal tube, and this is the lung bud, and these lung buds will be invaginated into the pericardio-peritoneal canal, and which ultimately they form the pleural cavities. Clear? And this is the tracheoesophageal septum, where it demarcates, or where it divides the foregut from the diverticulum, respiratory diverticulum. These are all the different stages of the development of respiratory system. Now, as I said, this laryngotracheal tube, it gives off, there are some derivatives. The derivatives of laryngotracheal tube are the trachea, the larynx, the trachea, the bronchi, and the lung tissue. So already the larynx has been discussed in the head and neck. So now we'll discuss about the development of the trachea. Is it clear, everybody? Yeah. The trachea, it develops from the intermediate part of the laryngotracheal tube. So if this is the laryngotracheal tube, the upper part will give rise to the larynx. The lower part, you can see the bronchi and the lung tissue. The intermediate part of this laryngotracheal tube will give rise to the trachea. So trachea develops from the intermediate part of the laryngotracheal tube that lies between bifurcation of lung bud and larynx. Absolutely right. So between the lung bud, the bifurcation of the lung bud and the larynx, you see the intermediate part of the laryngotracheal tube, which gives rise to the trachea. So this part will give rise to the trachea. So trachea develops from the intermediate part of the laryngotracheal tube that lies between the point of bifurcation, um, bifurcation into the lung bud and the larynx. Next, the endoderm of the laryngotracheal diverticulum forms lining of trachea. I told you the first that the respiratory system develops from the endoderm. The epithelium develops from the endoderm, whereas the muscles, cartilages and other tissues which are related to the respiratory system, they develop from the splantino-pleuric intraembryonic mesoderm. So the lining epithelium of trachea will be developed from the endoderm. Then the trachea is separated from the esophagus by the septum, which is called as a tracheoesophageal septum. Yes, the trachea is separated from the esophagus by the tracheoesophageal septum. And the bifurcation of the trachea lies at the level of the fourth thoracic vertebra, the lower border of the fourth thoracic vertebra. At that level, the bifurcation of trachea will be lining. That you can also see the events taking place at the sternal angle also. So at the events taking at the sternal angle also, you can put this point. The trachea bifurcates into right and left principal bronchi at the lower border of the fourth thoracic vertebra. This is about the development of the this is development of the trachea. Next, there are some developmental anomalies of the trachea. So trachea developmental anomalies we have, and these developmental anomalies of the trachea are here. You can see in the picture there are types of tracheoesophageal fistula. Tracheoesophageal fistula. So this is nothing but there is an abnormal communication between the trachea and esophagus. So between the trachea and esophagus, in fact, there should be no communication because both these tubes are separated by the tracheoesophageal septum. But at some times, you see some abnormal communication is established between the esophagus and the trachea, and that condition is called as tracheoesophageal fistula. In the short form, we can put it TEF, tracheoesophageal fistula. And there are different types of tracheoesophageal fistula. Now in the first, you can see where here the upper part of the esophagus end is with the blind. It has got a blind pouch, and the lower part is communicated with the trachea. This is one type. And next we have the another type also, where the communication here is established by a fibrous cord. Now the establishment of this communication is replaced by a fibrous cord. This is one type of this. And next we have another thing where the both upper and lower parts of esophagus, the upper proximal, lower distal, these two parts of esophagus will communicate with the trachea by a common channel. So there is a common channel where you see these two things will get communicated, and this is also called as H-shaped tracheoesophageal fistula. Next we have the other thing, the esophagus communicates with the trachea and the lower end forms the blind pouch. This is just opposite to the first. The upper part will be communicated with the trachea, but the lower part will be forming a blind pouch. This is another type. Next we have another part where we have the communication will be, again we have two, the proximal part and the distal part of the esophagus both get communicated with the trachea, but here it is not a common channel, where they have separate channels. The upper part will have a separate channel and the lower part will have a separate channel, both that get communicated, which is opposite to this where you have the common channel. These are the few congenital anomalies of the trachea in development, and this communication established between the trachea and esophagus is called as a tracheoesophageal fistula. Not only that, we have another things like tracheal stenosis. Stenosis means narrowing. So we have tracheal stenosis, which may be due to the anterior deviation of tracheoesophageal septum. Next we have tracheal atresia, where atresia means with obstruction. Okay, and not only that, we have the tracheal bronchus. This is also one of the condition which is called as a tracheal bronchus. Now this is the tracheal bronchus. So this is a trachea, and these are the two principal bronchi, and we have some accessory bronchus over here which is called as tracheal bronchus. And this tracheal bronchus which may be or not, which is sometimes present as a diverticulum, as a blind bronchus, we can call it as a blind bronchus. And Not only that, to that blind bronchus, you can see the lung tissue can be also developed, which is accessory lobe of lung. All these are the different developmental anomalies of the trachea. So with this, I conclude the respiratory system development. In that, I have completed the development of trachea with its anomalies, and in the next session we will discuss about the development of the bronchi and the lung. Hope you understand. Thank you.